Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine in one of the large medical schools in the United States. Today we're going to address a major research finding recently published. It's actually a poster talking about the fasting and the relationship with the cardiovascular death. Okay, it has gained international attention, saying the message the media is trying to send out is about if you fast, you're going to die of cardiovascular disease. So let's look at the study and see like what did they publish and what is wrong with the study. Is the study can somebody use this study to make an assumption? Those are the main thing we're trying to look at it. Okay, so this study was actually a poster presentation done in the American Heart Association. They have this epidemiology conference, and initially what they do is most of the research papers, you make a poster and you present it into the meeting, and then you try to get a publication on one of the bigger journals. Okay, so that's the way they did. So the researchers, I think the doctor's name is Dr. Victor Song, is a professor of Department of Epidemiology and Biostatistics at Shanghai Jiao University School of Medicine. Well qualified doctor. Now, what did they look at it? They looked at this huge database called National Health and Nutritional. Actually, it's called NHANES. Okay, it's the National Health and Nutritional Examination Survey. It's a huge database, around like 20,000 people in the United States. What they do is they interview 20,000 people all across the United States and ask them 20,000 questions, and they go and get 20,000 or labs, and they put it in a huge database for the researchers to use. So anybody can access. Data is de-identified. They take all the identifiable factors and put it on the website. It's actually, you can go to the website. If you want to do a research study, you can get the data. So that's the same thing about where this data came from. I have published at least 4 or 5 papers using this NHANES data, which is the National Nutritional Health and Examination Survey. Remember, it's a survey data. Okay, you have to be very careful, but which will come back to that. And if you look at it, I have published many papers using this data set. This is a survey data. Again, the survey was sent to 20,000 people. So they looked at the researchers, Victor Zong, who went into the database, which anybody could do. And they looked at the data, and then they looked at this question, how many hours you were fasting. So they were looking at the people who had fasted 16 hours. They were eating for 8 hours. That's the most popular method in the United States. You eat for 8 hours and then you fast 16 hours. It's getting very popular. A lot of people doing, and studies have shown previously, have many benefits, increasing weight loss, diabetes, cancer, and all that has shown up in the past. Okay. So those are the questions in there. People were eating only for 8 hours and 16 hours they were fasting. And they did some analysis, and they found out the results were, those people who were fasting for 16 hours, 90% risk of cardiovascular death. And they published as a poster in the American Heart Association epidemiology meeting. And then media picked it up, and all these bad things about the fasting came, and everybody's scared. I get a lot of calls, friends, and hey, what's going on? Should I fast or should I stop fasting? I am still very surprised by American Heart Association leaving a poster and asking for cheap publicity in this matter. You have to understand, the full paper is not out there. Okay, they have not publish the full paper. Only when you get a full paper, and then you can understand how did they do the analysis, what are the strengths, what are the weakness, are we making the correct interpretation of the data. That's very important. But American Heart Association did not take that effort to release such a data, which is like scary data, to the public, so everybody's like scared about doing intermittent fasting, giving a bad name to intermittent fasting. Now, I don't know, maybe they did not do it on purpose. The damage is already done. Again, this is a survey data from 2013 to 2018. They have asked some questions, do you fast? And then they looked at the mortality, like how does people die? The problem with this data set, and people die, we don't know what caused. They could be hit by a bus or they could drown somewhere, and that's considered as a death due to fasting. So I am not saying like we should not take this study very seriously. We should take it, but we also understand this is not the way, this is not the correct method of doing the study. There's a lot of weakness about the study, which I am very doubtful about the findings. Okay, again, anytime you do a survey study, you asking people, and most of them, they don't remember, and they're just trying to make up some of the stuff and all that. So you have to be very, very careful when you take a survey data. So you have to do maybe a randomized control study. That's the proper way to do before we can make an assumption fasting is bad. Right? Because if I ask the people, like a lot of friends fasting, if I ask them, like, how many of them can say I did not eat for the 16 hours, right? It's very hard in today's social situation. They might have gone Saturday night and have taken more than 3 meals and all that. Are they doing consistently? That's very hard. When you have friends, they're doing. I have seen that. Like 1 or 2 days they might not fast, and they might have to go back to the olden ways and all that. So again, when you look at the study, I would not take this very seriously. I would wait for the full study to come out, okay, and let them publish the full study and let everybody criticize. Let's look at the statistical method they use. And again, this is a survey data. I would not, at this point, will not take any survey data very seriously. Again, the reason I'm saying that, I have done research on the enhanced data set. If you do Google search, you can see at least 3 or 4 papers I have published using this data set. But this is only for an assumption or hypothesis, and then you have to do this randomized control studies, and before you can clearly say fasting is beneficial or is harmful. Okay, please do not try to scare people by just on the study. Again, this is a poster, my friends. Where exactly the study? When you have like American Heart Association have a bigger responsibility to the people in this country. When you have, I have gone to the meeting like this. I have presented posters and all that. You have to be, you have to tell the public, look, this is only a poster. The full paper is going to be out. Let everybody look at it. When the process, when you try to publish a paper, that's not even taken into consideration, right? I have published so many papers. So when I write a paper, what happens is I send it to the magazine or the journal, and there's a process called a peer review. So they look at it, they criticize it, they may ask you to reanalyze the data, and none of this done in this poster presentation. Nobody has done that. Nobody has done a peer-to-peer. Hopefully, this guy will publish the full paper so we can see where exactly the data, how did he analysis. I'm pretty sure by looking at his qualification, he's a very well qualified doctor. There's nothing, but this is not the data set they should be using. Should not be, I'm having doubts about survey data. How many people remember how many days they fasted? If I ask any of my friends who's been doing this fasting, they might say, oh, last week I could not keep up with my diet plan because I have to go out, I have to meet with my friends, or I went to Saturday night, and so all these things they will not take into good consideration. They also looked at mortality. That means, how did these people die? Do we know how did these people die? No. Only thing though, they died. So how can you say they died of cardiovascular cause of death, right? You can, they could be hit by a bus, and this is considered a quote, like this happened because of the fasting. That's the way this data set designed to. It is good for a preliminary hypothesis, but more studies need to be done. please don't be alarmed. Fasting still have like a lot of benefits. And if you have any questions, please put it under the comment section so we can answer. Again, I'm very, very sad American Heart Association has taken putting up this poster in such an important meeting to confuse a lot of people, and the damage done is like too much. I don't know what we can do now, but let's wait for the full paper and I'll do an analysis, see how Dr. Victor Song came up, how did he make the paper, and where is he going to get published. Is any magazine is going to publish it? I'm not even sure. Right, this is a poster. Nobody look at it. Anybody can go and say like, hey, this is a poster, I did this analysis, and just put it out. There's no peer review when you look at a poster. But when it's a paper, there's a peer review process. Somebody's going to look at your analysis, somebody's going to criticize, somebody's going to ask you a question. There's a lot of answerable question in today's world we have to do when we talk about research, and this is not the way to do research. American Heart Association, people trust you. There's a big responsibility on your on your shoulder when you said, we have this poster and you release to the media, and scaring a lot of people in the world about intermittent fasting. You should not have done it the way I look at it, okay? Because the way media portraying is like, if you fast you're going to die. That's what a lot of people are scared now these days, and all over the world, because this poster is out there. And who's going to be answerable for that? Is it American Heart Association is going to take the responsibility? And they should take the responsibility for that. The people, the normal people, they might not have the knowledge about the research. They might not know like how the research was conducted, right? And so you cannot scare people like that, especially when it comes to their health and all that. Again, thank you so much for watching. Once the paper come back, we'll do another analysis. And please, if you have any comments, put it under the below section, okay? Thank you so much. God bless. Take care.